How long should therapy last?
That's an excellent question. Duration of therapy really depends on the client and their needs. So I have some clients who might come for just 1 or 2 sessions. They just had to deal with something really specific, give them the tools, and they're gone. Other clients, maybe it might be 4, 8, 12, 20 sessions. Other clients have such extensive and long-standing issues that they come for years, and they need that in order to really make the change in themselves that they're hoping to make. So it really depends on the client, but the therapist should always be checking in with them to see whether, after a month, I always check in at the first month and then every few months to see, would you like to now start spreading out the sessions a little bit? I don't want to foster a sense of over-reliance or over-dependence on me. I want them to feel we've been dealing with serious issues, or not so serious issues, and they have the tools and the ability, and I hope the confidence to be able to deal with these issues on their own. But they know that if they need to see me either on a weekly or bi-weekly or however often, as needed basis, if they need me, I am there for them. And so when I say maybe stretch out the sessions, I have to be very careful. Any therapist has to be very careful not to make the client feel that you're rejecting them or abandoning them, because they may have those issues, and even the most innocuous statement might be taken as a complete rejection. So as long as it's dealt with properly, and as long as the therapist is constantly checking in with the client, I think you can determine the duration that way, because a client oftentimes won't even ask that, or they might be thinking about, wait, I've been coming here for months and months and months, when does it end? But they might not want to insult the therapist. It's not an insult. The client and therapist should always feel that they're working together. And even though the therapist has the expertise, the client knows themselves as well. And they should be able to, kind of give their input as to where they feel therapy is going, talk about it, and work together to come up with the best solution, whether it's the type of therapy or the duration, working together and finding out what is best for the client.